Hello, everyone. My name is Jibril Sanders. Today, I will be discussing telehealth as an emerging healthcare technology and how it is reshaping nursing practice, patient access to care, and healthcare delivery systems. What is telehealth? Telehealth refers to using technology to deliver healthcare services when the patient and provider are in different locations. While many people think telehealth only involves video visits, it actually includes a wide variety of digital healthcare services, including remote monitoring devices, secure messaging, and mobile applications. Telehealth improves access to care for patients who may have difficulty traveling to healthcare facilities due to distance, disability, or chronic illness. Development of telehealth. Telehealth is not a completely new concept. Healthcare providers have used telephone communication with patients for over a century. During the 1960s, NASA advanced remote health monitoring by developing technologies to monitor astronauts' vital signs while in space. As internet technology improved, healthcare organizations began incorporating telemedicine into routine care. However, telehealth experienced unprecedented growth during the COVID 19 pandemic when in person visits became limited, making virtual healthcare an essential method of delivering safe patient care. Need for telehealth. Telehealth emerged as a solution to several long standing healthcare challenges. Many rural communities have limited access to specialists and primary care providers. Patients with mobility impairments or chronic illnesses often struggle to attend frequent appointments. During the COVID 19 pandemic, telehealth became especially valuable because it allowed patients to receive medical care while minimizing exposure to infectious diseases. Today, telehealth continues to improve healthcare accessibility and convenience for millions of patients. Types of telehealth technologies. Telehealth includes several different technologies. Synchronous telehealth occurs in real time through live video or telephone visits. Asynchronous telehealth allows providers and patients to exchange health information through secure messaging without communicating simultaneously. Remote patient monitoring enables providers to track patients' health data from home using devices such as blood pressure monitors or glucose monitors. Mobile health applications further support patient engagement by helping individuals manage medications, monitoring symptoms, and communicate with healthcare providers. Nursing impact. Telehealth has transformed nursing practice by extending nursing care beyond traditional healthcare settings. Nurses play a critical role in virtual assessments, patient education, chronic disease monitoring, and care coordination. Through telehealth, nurses can identify challenges in patients' conditions earlier, reinforce treatment plans, and provide timely interventions that help reduce hospital readmissions. Research also shows that telehealth nursing improves patient engagement and support better long-term management of chronic conditions. Social considerations. Telehealth has strong social benefits, especially in improving healthcare access for rural and underserved populations. It also helps patients who struggle with transportation, disability, chronic illness. Mental health services have expanded significantly because patients can receive care more privately and conveniently. However, the digital divide is a major limitation. Patients without reliable internet, smartphones, or digital literacy may experience reduced access, which can actually increase healthcare disparities if not addressed. Ethical considerations. Ethically, telehealth raises important questions about fairness and quality of care. Patients must be fully informed about the benefit and limitations of virtual visits before consenting. Another ethical concern is equity. Patients with limited technology access may not receive the same quality of care. Nurses must also work to maintain therapeutic relationships even in virtual settings, which can be more challenging without physical presence. Legal considerations. Telehealth must comply with strict and legal regulatory standards. HIPAA remains the primary law governing patient privacy and data security. Providers must ensure that all communication platforms are secure and encrypted. Another legal issue involves licensure. Since providers may not always be allowed to treat patients across state lines, documentation must also be thorough because telehealth visits are considered official medical encounters and with the same legal weight as in person care. Usability. Usability refers to how easy telehealth systems are for both patient and healthcare providers. Most platforms are designed to be simple and intuitive, especially when integrated with systems like Epic or MyChart. However, usability challenges remain for older adults or patients with limited digital experience. Technical issues such as poor internet connection can also interfere with care delivery. Cost analysis. Telehealth can reduce healthcare costs over time by decreasing unnecessary emergency visits, reducing hospital readmissions, and eliminating transportation costs for patients. However, implementing telehealth systems requires significant upfront investment in technology, training, and infrastructure. Reimbursement policies also vary, which can limit financial incentives for providers. Comprehensiveness. Telehealth is not meant to replace all inpatient care. It is most effective for chronic disease management, mental health services, and follow up visits. However, it has limitations when physical exams or hands on procedures are needed. Because of this, the most effective healthcare model is a hybrid system that combines telehealth and traditional inpatient care. User satisfaction. Research has shown that both patients and healthcare providers generally report high satisfaction with telehealth services. Patients appreciate the convenience of attending appointments from home, avoiding travel, reducing time away from work, and receiving faster access to healthcare providers. Healthcare professionals benefit from improved workflow efficiency, better communication with patients, and increased opportunities for follow up care. However, technology difficulties and the inability to perform comprehensive physical examinations remain challenges that can affect overall satisfaction. Impact on healthcare outcomes. Telehealth has demonstrated positive effects on healthcare outcomes across many patient populations. Patients with chronic conditions such as hypertension, diabetes, heart failure, and COPD benefit from continuous monitoring and earlier interventions. Telehealth also promotes medication adherence and allows nurses to reinforce patient education between office visits. Research suggests that for many non emergencies conditions, telehealth outcomes are comparable to traditional face to face care while improving patient access and convenience. Future of telehealth. Telehealth is expected to continue expanding as healthcare organizations increasingly adopt digital technologies, artificial intelligence, wearable health devices, and remote patient monitoring systems will further improve patient care by providing real time health data and supporting clinical decision making. Nurses will remain central to this transformation by coordinating care, educating patients, and managing chronic illnesses through virtual platforms. Future efforts will also focus on improving health equity and ensuring that all patients have access to telehealth services. Conclusion. Telehealth has become one of the most significant technological advancements in modern healthcare. It has expanded access to care, improved patient outcomes, and created new opportunities for nurses to deliver high quality, patient centered care beyond traditional clinical settings. Although challenges related to technology, privacy, and healthcare disparities remain, telehealth will continue to play a major role in the future of nursing and healthcare delivery. Thank you.